Alhamdulillahi Rabbil Alameen, wassalatu wassalamu ala rasulihil kareem, wa ala alihi wa ashabihi ajmain, amma ba'd. Wa'udhu billahi minash shaitanir rajeem, bismillahir rahmanir rahim. Rabbi shrah li sadri wa yassir li amri wa hlul uqdatam min lisani yafqahu qawli. Dear all, assalamu alaikum wa rahmatullahi wa barakatuh. With the blessings of Allah subhanahu wa ta'ala, we warmly welcome you all to this medical camp. First of all, with great pleasure, I would like to call upon the stage Mujtaba Rahman of class 6 to present before you the Quranic surah in the form of Qirat along with the English translation. Dear Mujtaba.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل أعوذ برب الفلق من شر ما خلق ومن شر غاسق إذا وقب ومن شر النفاثات في العقد ومن شر حاسد إذا حسد صدق الله العظيم. The English translation of the following surah is: Say, I want to be safe from the master of the daybreak, from the evil what he created, and from the evil of the dark when it takes over, and from the evil of the blowers of knots, and from the evil of a jealous person when they have become jealous. Jazakumullahu khaira. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallahu khaira, dear Mujtaba. Now it is with great honor and delight that we welcome our esteemed medical professionals to the stage. Each of them embodies dedication, compassion, and expertise in their respective fields. Let's begin by inviting Mr. Ramesh Rahman to take his place on the stage. Next up we have Dr. Noor Fatima, followed by Dr. Nazish, next is Dr. Sadia Khan, and then Dr. Muhammad Kashif Siddiqui. Today marks an important day where we come together to prioritize health and well-being. We are delighted to see such wonderful turnout showcasing our collective commitment to well-being. Indeed, doctors play a crucial role in providing medical care, using their expertise and knowledge to administer treatments. However, ultimate recovery and cure come from the higher power. Hence, we must attribute the cure to divine interventions or blessings from Allah subhanahu wa ta'ala. Allah subhanahu wa ta'ala says in the Holy Quran, Surah Shura, Surah number 26, ayat number 80, وَإِذَا مَرَضْتُ فَهُوَ يَشْفِينِ, and He alone heals me when I am sick. Now, throughout the day, we have an array of activities and services lined up, tailored to address various health concerns and needs. From free medical checkups to informative sessions, fitness demonstrations, to nutritional consultations. We have covered it all. We believe that prevention is better than cure, and today we take proactive steps towards a healthier future. Without further ado, let's commence this event. Please join me in welcoming our esteemed speaker, Dr. Mohammad Kashif Siddiqui, a renowned expert in public health and wellness. Dr. Mohammad Kashif Siddiqui is a pediatrician and neonatologist. He had studied at a government college in Mumbai before pursuing further education in Boston, USA. Served 2 years as consultant in Apollo Hospital, New Delhi, and has been practicing in Allahabad for the past 3 years. With years of experience and passion for promoting health awareness, he is here to enlighten us on the importance of maintaining healthy lifestyle and the latest advancements in preventive health care. So let's make the most of this opportunity to learn, engage, and empower ourselves with the knowledge and tools for better health. We encourage you to actively participate, ask questions, and engage with our experts to make the most of this event. Let's welcome Dr. Kashif with enthusiasm, energy, and commitment to well-being. So.
Assalamu alaikum wa rahmatullahi wa barakatuhu. First of all, I want to introduce myself. Myself, Dr. Mohammad Kashif Siddiqui. I'm a pediatrician and neonatologist. I welcome all teachers, students, and dear colleagues in this medical camp. I'm honored to be here, and I thanks our principal Asma Shams ma'am, founder and the president of Taqwa Islamic Schools, Zia sir. And today I'm going to interact with all the youths. I think the students present here are between the age of 11 to 17 years of age. So I should talk about this phase of the life which is called adolescents. So most of the students here are above 10 years of age. So it is what is adolescence? I want to talk about the phase of life, about the problem, issues in this phase of life. Adolescence is a transition period. It's a transition period means it's a change from childhood to adulthood. बचपन से किशोर अवस्था तक जाने की उनको एडोलेसेंस बोलते हैं. एडोलेसेंस अगर आप बात करेंगे तो इस स्टेज ऑफ लाइफ में देयर इज़ अ मैसिव चेंज इन द बॉडी स्ट्रक्चर एंड फंक्शन ऑफ द बॉडी which are mostly mediated by the sex hormones. So in this period, during this stage of the life, the youth undergo a massive change in the structure, in the function, and the socio-economic status of the life, which is mostly mediated by the sex hormones. The presenting part of the youth is puberty. Why I am talking about this? Because in this social era, parents and teachers don't want to talk, and this produce a nuisance in the society when they gain information from somewhere else and their life is affected. So I want to say that youth, adolescents are under immense pressure. Firstly, the expectations from the society, the changing ideas and concepts of the life, making their self-identity. These are the issues where the youth face issues at this age of life. In this, the brain is usually follow a hierarchy pattern. What is a hierarchy pattern? It means the present growth depends upon how the future growth will be. The brain development of the future will depends upon the present growth. अभी आप जो भी activities, skills जो भी काम कर रहे हैं वो आपके फ्यूचर्स के स्किल्स को डिसाइड करेगा. अगर यहाँ पर वो स्किल्स, वो एक्टिविटीज़ में डिले होगा तो फ्यूचर की एक्टिविटीज़ जो है डिले हो जाएंगी. तो कुछ बातें हैं जो हेल्थ इश्यूज़ हैं, प्रॉब्लम्स हैं जो इस पीरियड में आते हैं. बॉडी के स्ट्रक्चर्स में चेंजेस आते हैं, एक गैप आ जाता है, पेरेंट्स, टीचर्स और स्कूल में इस गैप को फिल नहीं हो पाता है. तो टुडे आई विल टॉक अबाउट द हेल्थ इश्यूज़, द requirements the adolescent this period in 11 to 17 years of age, the girls and the boys needs. The first part of the adolescence is puberty. What is puberty? Puberty is the development of the secondary and the primary sexual characters. It is the part and parcel of life. In girls, this first development is thelarche. What is thelarche? It's just development of the breast buds. And then there comes a pubarche phase, where there is a development of pubic hairs. And in the last, there is menarche phase, in which the menstruation cycles of the female started. The hygiene and of menstruation should be told to the students by the parents and the teachers. And in boys, the puberty starts with growth of the testicular volumes, and then there will be growth of the sexual organs. In adolescence, there are various issues which I am going to address. So, in adolescence, there is preparation of adulthood. Matlab you are going to be in the adult phase of the life in few years of life. So you have to prepare yourself for the future in this era only. It is from development of sexual function to abstract thinking to independence. What are the health disorders in adolescence period? इस फेज में आपको क्या क्या disorders होते हैं जो आप को अपने पेरेंट्स से, अपने टीचर्स से you have to talk. If you don't talk, these issues will never going to resolve, because these are not medical issues. These are the counseling parts which has to be addressed by the parents, by the teachers and by the colleagues. First is eating disorder. Usually in this stage of life there are various illness. Usually it's affect the girls. The first illness is anorexia nervosa. The girls, by learning from the pictures of shape and structures, wants to be slim. They don't eat. They become, due to menstruation cycle, they become anemic. Around 50%, the data from the Indian Society of Pediatrics, 50% of the Indian girls are anemic. So the part is anorexia nervosa. It's a mental disorder. If it is not treated in the early phase of the life, it will produce a huge problems in the adulthood. The other one is bulimia nervosa. In this, we eat and then we vomit. If anyone have issues that they want to have a better picture, better presentation, they should talk to the pediatrician. The second disorder is mental health disorder, anxiety, disturbance, and anxiety, depression, and sleep disturbance. During the adolescence period, there is a hormone melatonin. In this phase, the melatonin is secreted in the late phase of the life. It is required for the sleeping habit. So, in the adolescent period, नींद देर में आती है. This is the normal physiological changes. बच्चों को रहता होगा हमें नींद नहीं आती है. जब नींद देर में आएगी तो मॉर्निंग में लेट उठेंगे, तो स्लीप साइकिल डिस्टर्ब हो जाती है. So what is the problem? This is the problem, and how it is to be resolved. The thing that are going to be distracted in the night should be avoided, like mobile, television, the tea and coffee should be restricted after 7 p.m. You should go to sleep, because when you are going to sleep, then the hormonal and physiological changes occurs in the body, and the hormone melatonin is secreted. It melatonin hormone cause sleepiness. So when the sleep cycle is disturbed, your school performance get affected. You get sleepy in the school, your performance go down, and the parents and teachers are not able to understand why the student is not sleeping early in the night. So it is a known fact that this is the thing that adolescents are affected. नींद जल्दी नहीं आती है, तो उसके लिए जो मैंने बताया कि मोबाइल, टीवी, ये सब रात को डिस्ट्रैक्टिव चीज़ें हैं, है ना. इट शुड बी अवॉइडेड. टी कॉफ़ी शुड बी अवॉइडेड आफ्टर 7 p.m. and you should go early in the bed. School and learning disorders, that I will talk later. There is refractory error disorders. Most I say myopic and patients in which the eyesightedness is weak are not detected early. When there is school performance is decreased and some other issue, then it come into notice that the eyesight is weak. So the parents, teacher should notice that whether the child is able to see from behind. So always there are some front benchers, there are back benchers. So this thing should be resolved by making a rotation policy. The first benchers will go to the last in a week, and the last benchers would come in the front in a rotational wise manner. This would cause early detection of the eyesightedness weakness, and that should be addressed to the parents. There is UTI. UTI is urinary tract infection. This is the most common cause of fevers in adolescents, because the hygiene part is not covered. When you are going to the washroom, you should learn how to clean your sexual organs, because it has to be addressed by the parents and by the teachers. The problem of acne in girls is quite obvious during this adolescent period, but it's a normal physiological hormonal changes which occurs in the body. The thing what you have to take care is that you have to make clean your skin, you have to maintain the hygiene, and you don't have to worry about the acne, because it's usually going to be resolved after 18 to 19 years of age. And the last is pubertal disorders. Preventing obesity. So obesity, it's more common in boys rather than in children, rather than girls. So obesity, how to resolve that? Daily physical activity, fruits, milk, meat and beans, vegetables, these are the things you have to take. You have to avoid junk food. Once obese is always obese. Means when you grow, the number of cells first increase, and then they grow in size. And when the nutritional requirement grow, then they again grow in number. But after reaching a certain limit, if you want to reduce the weight, the cells are not going to reduce in number. They just shrink. So once obese is always obese. So in adolescent period, we should avoid to gain weight. Gaining weight doesn't means if someone is more than 60 kg in 15 years of age is obese. It is the standard which is decided by the pediatrician, by the neonatologist, that you are obese or not. Preventing lifestyle disease. Will today child is tomorrow cardiac patient? आज का बच्चा आगे का कार्डियक पेशेंट हो सकता है? बिल्कुल हो सकता है. Possibly yes. Most adult lifestyle have their onset in childhood and adolescent. In this period, your health disorder will be decided. Obesity, hypertension, dyslipidemia, alteration in the lipid levels, insulin resistance, and smoking. These are all the causative factors. What are the 10 commandments I want to give you for a healthy and longevity? First is no tobacco. Second is no trans fat. Trans fat is डालडा घी, ठीक है, you should avoid that. Reduce salt, pickles, papad, these should be reduced in your daily requirements. Reducing sugar, how you will reduce sugar? Cold drink, ठीक है, contain high amount of sugar, that will damage your body. Chips, these are the things. Reduce cholesterol. How will you reduce cholesterol? Exercising daily, preventing sedentary lifestyle. Sedentary lifestyle हर वक्त बैठे हुए हैं मोबाइल पे, टीवी पे, क्लास में, है ना? You should be active. Reduce TV and computer time. You should watch TV and computer, but there is a time limit for that. You should decide that how much time I am going to give for TV or computer. You should gain knowledge from that also, but that would be for a certain period of time. Increase physical exercise. Increase fruits and vegetables. These are the main source to be healthy. And increase family quality time. That should be addressed to the parents. Good menstrual hygiene practice. It has to be addressed because the girls should know how to maintain a good menstrual hygiene practice. Good personal hygiene gives self-confidence. Do not use chemical disinfectant. Ask the parents whether it is good for you or not good for you. If you don't want to ask your parents, you ask your parents that take me to a pediatrician so that I want a counseling from that part. Some parents are hesitated to talk, so the students should tell their parents that I want to counsel by the pediatrician, by some expert. Before onset of flow, it may be comfortable to trim the hairs around the genitalia, and that sometimes may leads to folliculitis. That has to be addressed. That has a separate lecture. I think Dr. Sadia will take that. Use neat dry napkins. Wash genitalias before it. Before going to bed, boys and girls should wash their genitalias before going to bed. This is the clean habit which prevent the UTI infection, which will be in the adulthood. Sleep problem, I think I have addressed before, and it is estimated a quarter of young children have severe sleep problems. Some are from the beginning, while others only occur at a certain time. What is counseling? Counseling is not advising. It is not advising. It is not a treatment. It does not solve all life problems. It is aimed to help people to make choices and to act accordingly. So counseling is very important. A school should have a counseling session, a counselor which should spend around half an hour in a week with the students. They should be comfortable with the counselor, what the issues they are facing in the schools. Counseling is a learning process. It's enable personality development, and it's required during the adolescent period. Who require counseling? The second question is who require counseling? Counseling की ज़रूरत किसको है? स्कूल का परफॉर्मेंस बेटर नहीं है. स्कूल का परफॉर्मेंस इन टर्म्स ऑफ एजुकेशन ही नहीं होता है. इट इज़ ऑलवेज नॉट दैट यू आर अ गुड लर्नर तो यू आर गोइंग टू बी अ ग्रेट सक्सेस इन लाइफ. एडजस्टमेंट एंड पर्सनालिटी प्रॉब्लम है, तो इस पार्ट को काउंसलर के थ्रू इशू करना चाहिए. बिहेवियर्स प्रॉब्लम्स हैं, बिहेवियर प्रॉब्लम्स, बहुत सारे मेंटल डिसऑर्डर्स हैं जो कि अर्ली एडोलेसेंट पीरियड में डिटेक्ट होना ज़रूरी है. कुछ बीमारियां जो चाइल्डहुड में शुरू होती हैं, कंडक्टिव डिसऑर्डर्स हैं, बात नहीं मानना, चीज़ों को अपने हिसाब से करना, वो आपको इस पीरियड में वो एग्रवेट होती है. और ये पीरियड एक ट्रांजिशन जोन है जिसमें लर्निंग एबिलिटीज़ तो बहुत होती हैं मगर एक दिमाग में जंग होती है. उस जंग को काउंसलिंग के थ्रू ही एड्रेस किया जा सकता है. मेंटल हेल्थ इश्यूज़, if you are facing some issues, you should talk to your parents, to your teachers, and at last, if it is not resolved, you talk to your pediatricians. How to promote good study habits? Good study habits क्या हैं? Have regular study pattern. Read tomorrow topic today. What is to be taught today should be read tomorrow, because you have a better idea what you are learning. If the teachers are giving some homework that this topic is to be taught tomorrow, you should go through half an hour, 15 minutes with that topic. Then you will learn that topic more accurately, more precisely, and it will take less time for you to gain from that topic. Better concentration. How you achieve better concentration? By writing. It is the most effective tool. If you write, you will learn what are the things you don't understand. Write down key points, repeat the same many times. Just write. By writing, you are going to learn a lot rather than memorizing. Reduce personal factors, distractions in study. Set target and insist on meeting that targets, but don't make that an anxiety issue. To come in first in the class should not be your goal. Your goal should be to learn the things. Promote ambition and motivation, internal from within and external from the environment. Healthy parenting. An example I will give, the young plant will grow when it will give nutrition from the soil as well as from the environment. If it is devoid from any of the factors, whether from the soil or whether from the environment, it is going to be dwarfed or distorted growth. Types of parenting, I think I should skip because parents are not here, but the teachers are here. So I should tell there are 3 types of parenting. First is there is authoritarian type, in which there is only commandment. The commandment part, and the second is permissive type. Permissive type when you give permission for all. And the third is democratic type, which is the combination of authoritarian and permissive type. So what is the issue of authoritarian type? When you give authority, the parents give authority, you have to do this without explaining. That the outcome will be the student will be obedient, distrustful, discontent, withdrawn, unhappy, hostile, not high achievers. So this authoritarian type, the teacher should convey to the parents that it should be avoided. The second is permissive, permission for all, कोई रोक टोक नहीं है. It will lead to aggressive, least self-control, least exploratory, and mostly unhappy. And the third is democratic. This is the best type of parenting, in which the outcome will be happy child, mostly self-reliant, mostly self-controlled, high achiever, less likely to be seriously disrupted or delinquent. This is the all. I think we have to start the health checkup. I think I should stop here, but you can talk with me anytime if you have any issues. I would be available for all of you. If you have any issues, if your parents want to come, and you should have a counseling part, you have some issues, what I have addressed today, I would always be available for you, and thank you and all the best.
Jazakallahu khairan kasira, Dr. Kashif sir. You have delivered an insightful and engaging talk on health awareness, effectively conveying important information in a clear and accessible manner. Your contribution significantly enhanced the value of the event and left a lasting impact on the audience. We sincerely regret that due to shortage of time, we have to skip the question and answer session. Now, as we conclude the session, let us carry forward the knowledge, insights, and inspiration gained today to lead healthier lives and contribute to the well-being of our community. We extend our heartfelt thanks to all our volunteers, healthcare professionals, and support staff of Fatima Hospital who have dedicated their time and efforts to make this event possible. And a special thanks to our speaker, Dr. Muhammad Kashif Siddiqui sir. Wholehearted thanks to everyone involved for your invaluable contribution and support. Let's continue to work together towards a healthier and happier future. Jazakumullahu khairan kasira. Wassalamu alaikum wa rahmatullahi wa barakatuh.